Good evening and welcome to another episode of iMed, a program where we discuss on diseases, ailments and cures. COVID-19 or the coronavirus is something that has been talked about for over 1.5 years, not only locally but also globally. Who have been affected by the coronavirus? And with the various growings of various variants, the battle between the human and the coronavirus has got stronger and it's going in various directions. With the arrival of the vaccines, people are being vaccinated around the world to try and prevent many causes that occur from COVID-19. But coming to a very important segment in coronavirus, especially when you talk about the future of the world, the newborn babies or the pregnant mothers or the pregnant women, how are they affected by the coronavirus? Is the vaccine the best cure that they can get to save their newborn? Will the newborn be affected by the pregnant mother getting coronavirus? Well, to discuss all of that, I have with me consultant obstetrician and gynecologist of the Castle Hospital for Women in Sri Lanka, Dr. Sanath Lanarol, on today's topic of iMed, pregnancy and COVID-19. Good evening to you, Doctor.
Good evening, Chris.
Doctor, obviously coronavirus has really taken a lot of livelihoods, various ways, not only physically but also mentally has affected a lot of people. But how does this all affect, especially when you talk about the pregnant mother? Because you see the pregnant woman has been included in the list of people that are clinically vulnerable for this virus. Why is this?
Yeah, as you quite rightly mentioned earlier, COVID-19 is a new disease. We have only 1.5 years experience in this. At the beginning of the disease, nobody knows, and as doctors, we also learning about that. Until recently, we did have a lot of published data on this. A lot of scientific research have been carried out, and now most of the research data is coming up. So we have equipped with new knowledge about this disease. Based on that knowledge, it has been found that the effect of pregnancy on this is a bit of a different from normal female. The normal female, the way virus behave on their body is different on a pregnant mother. So why it is happening is, in pregnancy there is the immunity level is bit reduced. Because of that, any virus, any disease can attack pregnant mothers. This is the reason why pregnancy is different from the non-pregnant female. In Sri Lanka, we have annually 310 babies are born annually, and at given time there are 200,000 mothers are here with us. We have to look after this population. This population is quite large, 200,000 is, and so we have to protect them from this COVID-19 virus. Because of this virus behavior in the pregnancy, this is a pandemic. So management of this pandemic situation is different from just treating the disease. So things are different, and pregnant mothers are highly vulnerable to this COVID-19 virus if they are exposed to this virus during the pregnancy. Depend on the first 3 months, second 3 months and the third 3 months in the pregnancy, the behavior and the severity of the disease is different.
Just to interrupt you, Doctor, is it because of the immune system of the pregnant mother that this the way it can differ from stages to stages?
Yes, it is different because of that also, and the way immune modulation system is compromised with the virus, these changes can happen. So a lot of mothers, they have a fear if they get the virus in the first 3 months, what will happen to their babies. So clinical data and the scientific data has found, even the mother get the virus or vaccinated, there is no increased risk of getting the abnormal babies, congenitally abnormal babies, even in the first 3 months, and there are no significant increase in delivering these babies with the congenital malformation. So, these are the scientific facts that has emerged now in the world clinical data. Basically, most of this research has been done in United Kingdom and the USA, and most of these persons who has been vaccinated or who got the disease during pregnancy are the healthcare workers, because they were the first lot who got this experience. So, now they are delivering their babies, and based on that fact we have found there is no increase in congenital malformation. So, that is a good news we can give to the pregnant mothers. Do not get scared, do not get fear about the vaccines. Vaccines part I have to highlight. So, if you get the jab in the first trimester, so there won't be any problem to your baby during this COVID-19 pandemic area.
Doctor, does this virus, when you are contracted with the virus, does it differ from region to region or country to country on how the pregnant mother reacts on it, or the virus gets into their body?
Yeah, basically we have experienced first wave, second wave, third wave. So, first wave was very mild, it is region to region. Basically 85% of the pregnant mothers who has contracted the disease, it is very mild, and actually they do not show any symptoms. Only if we carried out a PCR test, PCR will be positive, but mother is just asymptomatic. Then another 10% will carry a mild symptoms, that is cough, fever, and then the running nose, sore throat, and the body aches and pains, and that kind of thing will be there. Only 5% of mothers, they went into COVID-19 pneumonia state, that is also very mild, that we have experienced in the first wave, second wave. But after the March, April this year, we have found that this Delta variant, that emerging of the Delta variant, we have found most of the mothers, about 30 to 40% of mothers, they got the severe illness, and they get very bad very soon, within 2 to 3 days time, and they have been oxygen dependent, and most of them they need ICU care. So, this is based on region to region, as well as then virus to virus, variants are coming up. So, disease severity is based on the variant what you are dealing with.
Doctor, another thing, how does the age also have an effect on it? Like, say you get young pregnant women, you get middle aged pregnant women, then you get a little fairly old pregnant women. Does that also have any effect on these mothers getting the COVID?
Yeah, exactly. There is a very strong point in that. If you are more than 35 years of age, then you are highly vulnerable, and the risk is very high. If you contracted the disease, then your pregnancy outcome will be it will not be a good one. Then mothers who are overweight, obese mothers, and they are also highly vulnerable. In Sri Lanka, we do not see much of the smoking pregnant population, but if you are a smoker, then again you will get the very bad outcome. Then there are some mothers with other non-communicable diseases like diabetes, hypertension, then this asthma, will say renal diseases, and that kind of whole sort of diseases. Mothers complicated with these diseases, they will get the worse outcome if you contract it. That is why we want them to be vaccinated, and the good news is, if you are vaccinated, what is going to happen is this disease severity will be less, and the spreading disease from one person to other person is less. And the third thing is the necessity for oxygen, that means oxygen dependency is less. And the fourth factor is the requirement to get the ICU facility is less. So, that is why vaccination is important in these pregnant mothers, especially when they are older mothers, and when they are with comorbid factors. These things are really matters.
I was going to ask you, where is the vaccine successful with pregnant women, but I think you have explained exactly on you really definitely. But no, Sri Lanka has another belief that, wow, we should get this type of vaccine, with obviously various types of vaccines coming in with various names. They should take this one, this is not good. Is there any particular reason, or is there any particular vaccine that they should take, or is every vaccine okay?
Yeah, that is a good question. Actually, the best vaccine is the vaccine you get first. That is what we have to recommend, because there are different vaccines, they based on different technologies have produced, but the effect is the same. So, our recommendation is whatever the vaccine you get first, please take that, and that will save your life.
And another thing, doctor, when it comes to the, for example, you're a pregnant mother contracts COVID who is not vaccinated and gets cured from the coronavirus, then is it good, or is there a period that mother needs to wait to get her vaccination done? If she
Yeah, this is also now we have seen this kind of mothers. They have contracted the COVID-19 disease, and then they get cure, and then vaccine is offered. So, recommendation is 4 weeks after you are being positive PCR, there is no harm of starting the vaccination first dose. So, please get your vaccine with the recommendation by your doctor, and it is recommended to get the vaccine after contracting the COVID-19, that is 4 weeks later.
And another thing is, like, say, people, another thing that they want to find out is, are there any side effects, or will there be any effects for the pregnant mother after getting the vaccination? Because those are things that the general public is very keen to find out.
Yeah, any vaccines has their own effects. They are very mild type of thing. So, generally they will get first day, second day, the redness in the area, itching, and some kind of feverish feeling, and but that will goes away with the time. Other than that, we haven't noticed any kind of severe kind of allergic reaction or any kind of thing. So far, it is not reported.
There is also a talk that you might end up getting blood clots and all that, various things. How far true is this, doctor? Have you come across any patients of that?
Yeah, so far in the globe there were few incidents, but they are not that significant to have a clinical impact on the vaccination. So, even any drug has side effects. So, based on that same thing in the vaccination also, but more benefits than that minute side effects.
What will the newborn have? Will the newborn baby have an effect, especially if the mother was contracted with coronavirus, and after birth, will the newborn have any effect towards?
Yeah, generally our experience is that if you contracted the disease during pregnancy, you are more prone to get these preterm babies. So,
preterm is premature, is it?
Premature, and they are preterm also. So, because of this prematurity, there are inherent problems coming up. One thing is that if your baby is born prematurely, then you have to put the baby into a neonatal ICU to look after your baby. So, that is a burden, that has lot of economical impact, and the baby will have problems of prematurity, that is there. Other than that, we have found that because of the comorbid factors like diabetes and all, there are some reported cases of stillbirths, and the number of stillbirths have gone up because of these COVID mothers who are going to deliver unless they were properly being looked after. Other than that two things, the third thing we have found is the hypertension. The pregnancy induced hypertension, we have found more incidents if you get corona the disease during the latter part of pregnancy. So, these are the problems that babies encounter, but there are hardly very little evidence that mother can pass the disease in utero to the baby.
And the other thing also, now this is the we talked about the mother getting the virus. Will there be any effect for the newborn once the mother is vaccinated? Will the vaccination have any effect on the baby?
Absolutely, there's no effect on the baby if mother is vaccinated. If mother is vaccinated in the as I mentioned in the previously first 3 months, there are some myths that you will get the abnormal babies. There is no scientific base on that. The number 2 is that you will cause more abortion. There is no real evidence to prove that the abortion, the miscarriages rate are similar to the non-vaccinated community. So far there are no evidence to say that these vaccines cause miscarriages or any congenital abnormalities of the baby. Then if the mother is vaccinated in the second and third trimesters, it is again same. So that will have a more beneficial effect to the baby, because the severity of the disease is less. Then mother will contract the disease, but mother will not go into COVID pneumonia status. And the important fact is, what we have found is, if the mother is vaccinated, there are some reported cases. These are bit high numbers. Those are maternal deaths, because if you get the coronavirus with the third trimester, with the comorbid factors like diabetic mother, hypertension and bronchial asthma, that kind of mothers, so their death rate is high. So important fact is, if you are vaccinated, then this what we have found is this death due to COVID-19 pneumonia is nearly 0. So that is another point of vaccinating during pregnancy.
Yeah, because I think that's something that people find out, because they say a lot of deaths occur with the COVID pneumonia situation coming in. So according to you, there's very little that the pregnant mothers have passed away with the COVID pneumonia situation.
No, there's a recorded number of mothers. They have passed away, but the reason is main reason. But when we are analyzing these things is that none of them got vaccinated. So vaccinated mothers, the death rate is very minimal.
Doctor, now during pregnancy, obviously apart from the COVID-19 or the coronavirus vaccination, mothers need to have other types of vaccinations, and so especially vitamins and various things. How will those have any effect if the mother is contracted with coronavirus?
Yeah, that's a very important question you ask, because we all forget about other things when we give the priority for the COVID-19. So important message which I have to pass to the mothers is that you have to go to clinics regularly and get your regular vaccination. The most of the dilemma occurred in the tetanus toxoid vaccination, because some people think that these two should not take. There is nothing like that, and you can take your tetanus toxoid, you can take your COVID, but if you want to have a choose, you have to get the priority for the COVID-19 vaccination first, and then later take the tetanus toxoid. Not only the vaccine, there are other drugs, as you quite rightly mentioned. There are other vitamins. We are giving calcium supplementation, we are giving iron supplementation for the mothers who are depleted iron and calcium. Then there are mothers with diabetes and they are on diabetic medication, and the mothers with asthma, mothers with hypertension, and please continue this medication and come regularly to the clinics. Don't stay at home, clinics are open, and see your doctor and continue this medication. By doing that, not only the corona, the comorbidities and the bad outcomes of these diseases can be reduced.
So what are the precautions or the steps that a pregnant mother needs to take if you are contracted with COVID-19? Can they be home isolated and then take medicine from home, or do they definitely need to seek medical attention and admit themselves into a hospital?
Since this maternity population is a small population, and out of that only very small people will contract the disease. Because of that, as a clinicians, as a professional, we advise them to contact your consultant obstetrician and get the advice. You have to get assessment, because in this COVID-19 pneumonic situation, there is a state called happy hypoxia, because your oxygen saturation will be low, but even though you will perform normal things and suddenly you will drop. We can't identify. There are tests to identify. When you come to a doctor, we will perform those tests, including oxygen saturation test, and we can find out whether you are in a red zone or whether you are amber or green zone, right? Yeah. So depend on that, that doctor will decide whether you will be home quarantine or whether you will be admitted to the hospital. especially the mothers with these complicated diseases, even they are asymptomatic, but PCR is positive, so we advise them to get admitted. Other mothers, depend on the medical advice, they can stay at home, but they should be supervised continuously, thoroughly, and very tightly. If they found any kind of respiratory breathing difficulties, then they should report it to the hospital and get admitted.
Doctor, another thing, now you talked about 3 stages, first 3 months, second 3 months, third 3 months. Now, for example, you're normally given your delivery date during your third 3 months. What happens if the mother is contracted with COVID-19 just 2-3 days prior to the delivery? Does the delivery get delayed?
No, absolutely no. If they get the delivery pains, they will spontaneously, they will naturally deliver. If there is any indication for a cesarean delivery, then that also has to be done, and there is no reason to be delay the delivery. Only thing is, if mother is severely bad, and if you want to resuscitate the mother, in that case you will have to do the emergency cesarean section, that is to facilitate the mother to look after the mother well. Other than that, there is no necessity to delay the delivery. Whatever the delivery date, when the mother get labor pains, and mother will have a normal vaginal delivery.
During this few months, obviously we heard that there are so many deaths that occur during a day in Sri Lanka. How is the death rate with the pregnant mothers that have occurred during this, especially with the Delta variant coming? Is it on a high level, doctor, or is it a decreasing level at the moment?
Yeah, with the first and second wave, there were absolutely 0 deaths, and with the Delta wave, there are recorded number of deaths have happened. So that depend on the virulence of this Delta variant, as well as the mothers' vaccinated status. The most of the mothers, almost all I should say, that they were not vaccinated, these recorded deaths. Because of that, only we would have prevented these most of these deaths if mothers were vaccinated. Even the Delta variant is very virulent.
Well, there you go. That is the advice coming to you from the professional Dr. Sanat Nanaro. Make sure that you get yourself vaccinated if you are a pregnant mother, because that is going to save you with a lot of difficulties and a lot of after ailments or whatever that is going, to have a very healthy newborn baby. And obviously, according to doctor, your newborn baby is definitely not going to be affected by any vaccine that you take. So make sure that you take the available vaccine as soon as you get the opportunity, because that will help you have a healthy delivery with your newborn. Thank you very much, doctor, for joining us on this program and giving very important insights on what a pregnant mother should do if she's contracted with coronavirus, and that they definitely need to take the vaccine. Thank you very much, sir. Well, with that, we come to the close of another edition of iMed segment of pregnancy and COVID-19 was today's topic. Hope to see you on our next episode of iMed. Till then, it's a good night.